I was just making a video recently, and the video recently was on the term diverticular disease. So I got to see that diverticular disease is the same thing as what diverticulosis. All right. So when I went online to like download pictures for diverticulosis, I got to see that the pictures were combined, like it was diverticulosis and diverticulitis. Then I checked on YouTube, like, what's up? Is there a video that is trying to differentiate between diverticulosis and diverticulitis? And so, behold, I didn't find it. So it was confusing to me at the time. So I just said, like, okay, let me make a video because there might be people out there who are finding these concepts confusing too. All right. So diverticulosis and diverticulitis, those are the things we are going to talk about today. All right. So first of all, we'll be talking about what diverticulosis by itself. When we are done, we'll talk about what diverticulitis. All right. So we'll talk about diverticulosis by itself, then talk about what diverticulitis. All right. So then now what combine the two and talk about the key differences between the two concepts, right? So for definition, this diverticulosis is the presence of what? Small pouches in the colon wall, right? So diverticulosis is the same thing as diverticular disease. Capital the same thing, all right? Like it's just another word for diverticular disease, right? So the presence of small pouches in the colon wall, just small pouches. There's no inflammation. So when diverticulitis comes in now, once you see itis, since there's what inflammation, right? So there is what presence of these diverticulars or small pouches in the colon wall. So they are typically what? Asymptomatic. Most people with diverticulosis require no treatment. No treatment at all. Alright? So it may occasionally what? Okay, may cause occasional bloating, constipation, or abdominal discomfort. It's common in people over 40 years old. Alright? It is often discovered during routine colonoscopy or imaging tests. Alright? So this is, we have discussed for diverticulosis. We have discussed diverticulosis. Alright? I received an image, SMS, so I'm just trying to check it out. Alright. Then moving to the next one, which is what diverticulitis now. Diverticulitis is inflammation of diverticula, and this is mostly due to what? An infection. It's not just good to just round it up and say it's only bacterial infection. It could be virus, it could be fungal, all right? Although bacterial infection is the most common, but just say due to infection on a general note, okay? So what are the symptoms? Patient will present to abdominal pain, which is usually what? In the lower left, all right? Usually in the lower left. You see that this side is the side that is what? Mostly affected, right? So if you turn this side like this, it's on the left side, all right? There'll be fever, there'll be nausea and vomiting, there'll be changes in bowel habit. That means the person will be having what? Diarrhea, constipation. There'll be blood in stool. What are the complications? This diverticulitis can lead to what? Abscess formation, can lead to perforation, can lead to fistula formation, can lead to what? Obstruction, right? It actually requires what? Prompt medical attention and what? Prompt medical treatment, okay? So this is what? If there's small outpouching without inflammation, that's what is known as what? Diverticulosis. If there is a small outpouching with inflammation, that's what is known as what? Diverticulitis, right? So what are the key differences? We have key differences in what? Symptoms. Where you are having diverticulosis is usually what? Asymptomatic. No symptoms, no treatment needed. But diverticulitis being an infection and inflammation now, you actually need what? A treatment, all right, and it's symptomatic, right? Inflammation, diverticulitis involves inflammation, whereas diverticulosis does not. What about the complications? Diverticulitis can lead to serious complications, whereas what? Diverticulosis cannot, typically does not, right, lead to complications, right? So those are the differences between diverticulosis and diverticulitis.